with the current scenario of COVID pandemic extending for the last couple of years, there has been a serious increase in not only the eye problems, but a significant factor of that is myopia or minus power, which the children are having over the last 2 years. This problem was there even before, but the prevalence of this condition has increased significantly over the last 2 years. So myopia is a refractive error wherein the child is having nearsightedness. Nearsightedness means they would be able to see things which are closer to them, but they won't be able to see things which are far off. So now, with children not having any physical glasses, they hardly have to look at things which are beyond them or far off. So it is very difficult for the parents to assess these problems earlier, especially in this time with online classes. So the reasons why this is happening is because of the lockdowns and more online classes. Now children are spending so much time indoors. Their exposure to natural light is so much restricted now and so much limited. And also the fact that they are spending so much time on screens. So the screen time has significantly increased. They're not taking adequate breaks. The most common complaint being watering of the eye or eye strain. The children might have more squeezing of their eyes, they'll keep rubbing their eyes, the blinking rate would increase significantly, or they might also notice them going closer towards the television when they're watching television. So these are the symptoms which they need to look out for. Those who are wearing glasses also, or those who are not wearing. So this means that the power has changed in a children who is already wearing glass, or the power child has developed in a non-glass wearing child. The first thing that needs to be done is a physical consultation, because with online consultations now have increased over the past 2 years, but the fact that when you need to check the vision in a child, you need to get it done physically only. And if there is a need for glass, that would be required to start at the earliest. If we catch these conditions earlier, we are able to stabilize or limit the rate of progression in such children. So there are various measures by which we can do that. Myopia control can be done either using an eye drop, or there are specialized glasses which control faster progression of myopia, and also there is a specialized contact lens called as orthokeratology contact lens, which not only removes the need for a glass but also controls the faster progression of myopia. So any of those would be recommended by your doctor after doing your eye evaluation. So certain lifestyle changes are mandatory in children, which need to be inculcated to them in early stages itself, so that they don't develop power or minus power, or if they do have myopia, then it prevents faster progression. So first is to avoid continuous near work, whether it is reading, whether it is painting, drawing, or any near work which includes the screen time. It has to be done with frequent breaks. So there is a rule called 20-20-20, which means every 20 minutes the child needs to take a break and look at something which is about 20 feet away for at least 20 seconds. So if they follow this on a regular intervals, that also maintains their eye health. Apart from that, they need to spend more time outdoors, which again makes them look at very far off objects and also exposes them to the natural sunlight and improves their vitamin D levels.